I know of the time when First Nations people didn't come to the hospitals because they figured it wasn't a place for them. Racism that was so overt in the 40s and 50s really laid the foundation for Aboriginal elders to be afraid of this environment.
First Nations Health Programs is important because 1/3 population of the Whitehorse General Hospital is First Nation, Métis, or Inuit identified patients, and our program works directly with them. The program originated as a result, we needed a bridge between First Nations people and the medical system.
Just having some awareness around some of the historical impacts that have affected First Nations here in the Yukon and elsewhere, and that those actually make up part of who that person is when they're coming through the door. They might have had a poor experience in the past with healthcare or with other institutions, and you'll have to be cognizant of that when you're approaching the person.
What we do to support patients is we're able to be here and meet with them, connect with them when they arrive, make them feel comfortable, connect with them by finding out who they are and where they come from, and kind of finding a basis around that and connect them with each other and our families and friends, and so that they feel comfortable and are prepared for healing.
The First Nations Health Program is just the biggest thing is making people feel more comfortable being in the hospital. When you have people coming from Old Crow or any of the communities, they're traveling so far away from their support base, and to have someone who understands kind of what you're going through and what resources you may have back home or what resources you may need is huge. And I think we're extremely lucky to have that here. I know some other places across the north don't have that, so I think definitely in the Yukon we're extremely lucky.
The First Nations Health Program is often behind the scenes doing a number of things that you're not fully cognizant of, but then you realize that ability to look after the patient and do a good job with the patient has been really improved because of what the First Nations program is doing in the background in terms of communicating with family, making family feel comfortable in terms of their accommodation, providing some food, transportation, just all those things that if they fall apart can really impact the patient's care.
I think very unique aspect of First Nations Health Programs is that we have accommodations on site for people that come from the communities. So that encourages family to come with them and stay by them to assist them and support them while they're here in the hospital. We have an elder suite, which includes a kitchen and bedrooms, so a place where they can meet, gather, eat, and share food and conversation while a person's not well. We also have a sleep room upstairs on the floor of surgical, so that if someone comes in an emergency, we have a place for them to stay, a family member to stay close by. We have a healing room where we utilize that room for prayer, for gatherings, for drumming and singing, and also for the purpose of death and passing.
My dad passed away here, and we stayed here as a family using the suite that was available, so we'd always be here. The First Nations Health Program was there to make sure we had anything we needed, and to ensure that they would help us. I know this program is unique. This is a program that leads the way across Canada. Having a First Nations program that can provide First Nations engagement helps a lot in terms of getting people to just calm down and be aware of what's happening, and to engage in their own healing process without being worried about everything else.